Hello, good afternoon, good evening, everybody. Happy Saturday. Do I have a treat for you? And it is about your teeth. Today, we're talking about teeth and we're talking about why your teeth keep getting worse over time and what you can do to prevent it from getting worse. Now, I have some exciting presentations, I have some exciting things for you to actually see. So, I'm going to get straight to it, just letting you know that today is episode number 79. Straight up. Haven't missed a single day. So, claps for me. Anyways, so let's keep going. I do want to let you know that Spinatic Dentistry is the Consumer Choice Awards 2024 for dentists in London, Ontario, as well as for the second year in a row, top 3 cosmetic dentist winner. So those are the accolades, and we have other accolades as well, but I thought I'd highlight those two. Now, in today's agenda, in our small amount of time together, because this is going to be rather quick, but I'm going to show you some pictures. I'm going to show you a lot of pictures. My goal for you is to make a big impact in your oral health in the following ways. Confidence that your teeth don't have to get worse. And this is very true. I want to provide you clarity and a proven solution of how to prevent this damage without spending a fortune. Now, I want to actually get you to understand why this damage actually happens. And I want you to have confidence that you're going to be easily able to maintain your oral health without any surprises. Yet, if nothing else, I'm here to save your teeth. And in the meantime, to save you a lot of money in the process. Now, what I need from you, I need implementation, because nothing pains me more than giving you a solution yet running into you years later, clinging hopelessly to your oral health problems because of the often heard statement, I don't feel pain right now. In a few slides, you'll see the impact of this wait and see approach, which a lot of people take, but they don't understand the impact that it's going to have. Now, here's a picture with me and Christian Coachman, and he said, patient will be glad that they found out about this, but they have to take action. They can't just sit around and do nothing about it. Now, I do want to let you know that I traveled the world learning from the best of the best dentists, prosthodontists, cosmetic dentists, you name it. I went, surgeons, implantologists. I went across the globe, literally, no exaggeration, on how to actually perfect my craft at dentistry. And this man is no exception, Christian Coachman, who is the pioneer of digital smile design. And he is the one that came up with the concept. Now, do we have a deal? Hopefully, we have a deal. And if we have a deal, I just want you to raise your hand. Okay, so if I can't see you, I just want you to raise your hand that yes, I have a deal. I want to let you know how this came to be, and this is going to shock you because here you can see an image of teeth, but it's not straightforward. Now you can see here, I put this line and I put these miniature lines to indicate to you how much tooth structure this person has lost. Now, similarly, you can see with this one, I also put a line, and in that line, you can see the separation between the line and the amount of tooth structure that has been lost. This is quite significant. It is, it's a lot. And here you can see as you get older, you get a lot more progression, and you also start getting a lot more gum loss, you start getting bone loss. And here you can see it even more. It's even worse in this picture. And here as well. So you can start seeing how it starts with chipping. And you're like, okay, why are my teeth chipping? And one of the things that is really important to know is that chipping doesn't just happen. It doesn't just, a lot of my patients, they come in and they say, I was eating on something, or I was eating something soft, or I was eating something hard, I was eating popcorn or whatever, and my tooth chipped. I shouldn't have eaten that popcorn. And I joke with them and I say, well, how good was that popcorn? Was it worth it? Or how good was that chicken? But it's not that. It's not the chicken. It's not the popcorn. It's the consistent the your bite being incompetent. Your bite is incompetent, meaning it's not meeting where it's supposed to be. And so because you have incompetent bite or an unbalanced bite, what's happening is that you're traumatizing that enamel. You're traumatizing the tooth, and all it's going to take for it to break, for it to chip, is chicken or popcorn or whatever. But teeth are not meant to chip. If you are in a trauma, like you fall down and then it fractures, but it doesn't fracture like that. That's not how it fractures. Like I'm saying, like almost half the tooth goes, right? Unless there's constant trauma, and then you start getting these fracture lines, you start getting weakness in certain areas of the tooth, and then you start getting these kind of chips. But having these kind of chips is actually not normal at all. So let's keep going. This is the extreme example, but I see this consistently. I'm not joking. I see this all the time, but there's a reason for it. So, what do you hear all the time? What is it that you hear? Okay. Pardon me. Sorry. What is it that you hear? All the time, you hear that you're grinding your teeth and you need a night guard. Now, what about these? Okay. These are what we call abfraction lesions. Now, abfraction lesions, if you look in the literature, there isn't any conclusive evidence as to exactly what causes abfraction, but it is a multifactorial causation, right? So a lot of different things actually occur in order for something like this to happen. And one of them is a bad bite. And so here you can see the person is losing a lot of tooth structure and is you can see here as well. And I want to point to the fact that, these things here, you can see that the roots, right? So at this point, this patient, and I'm telling you, I see this on a daily basis. And if you lift up your gums, more than likely you have this too, because I see it consistently. Now, if you look here, the enamel part, the white portion is actually intact. It hasn't been touched, right? This is called the abfraction lesion. And you can see here as well, the white portion, which is the enamel, is not touched, but you can see a huge cave in, and you can actually start to see the nerve there. What else do you get told as well? You get told that you're brushing too hard, and you're not using an electric toothbrush, which is all true, but is that all? Is that all? So my question is that are all these patients hacking away at their teeth with a toothbrush and they're not wearing a night guard? Is that their punishment, or is there something else that's going on? Now, so I went and searched for the answer. And in search, I said, wouldn't it be nice to have a solution that would almost eliminate or significantly reduce all of these problems? And so then I spent thousands of hours treating patients. Very true. I'm in my nine and a half years of actually practicing, and thousands of hours attending continuing education, and actually a lot more than that, and thousands more researching and thinking about this kind of solution. And so here you see, I'm gonna just briefly talk about this. Here you see that when you have grinding, like severe grinding, not just grinding at night, but I mean when your bite is not proper, right? Like your bite is not right. I'm not gonna go into different kinds of bites, but when your bite isn't right, then you start getting these kind of situations where you have compensatory eruption happening, where you start getting the lower part of your teeth actually like it goes upward, right, towards, because it needs to meet something. And I drew these lines for you to actually see how much of a discrepancy there is. And then you can see here, because the person has crowns, the lower teeth got decimated. Now, this here is an example of what normal looks like, right, on the right side, and what abnormal looks like. And this is the wait and see approach. And you can also see here with someone losing teeth because they didn't replace them with implants, for instance, they also got compensatory eruption. So now they're getting their teeth all the way up. This is how it's supposed to be, right? So you can see here how I drew the line from the lower canine to the lower canine on both sides of the right side and left side. And here you can see on the other side, you can see what a healthy mouth looks like, right? Where the gum tissue is very close to that line. Whereas the other one, you can see a lot of gum tissue. Now, this is the before and after of some patients who've been treated with Invisalign. You can see here, this is a testimony from her herself when she said, 1 year later, I'm so happy I finally did this for myself. And you can see here, I mean, one of the big things that I always receive, and I treat a lot of patients in many different age categories, is that they say, oh, I'm in my, 40s or 50s or 60s. It's too late for me. I've treated people as old as 77, right, with Invisalign. And they have not regretted it one bit, because it really did improve the way they look. It improved the way that they actually eat. It improved the way that they, feel confident about themselves. It improved the way that their teeth meet together. It improved everything. And literally, I haven't heard anybody say, I wish I didn't do this. They always say, I wish I did it sooner. So there isn't a too late kind of deal. There was my rant. And this one, obviously, it's a young person. You can see he had a lot of crowding. And he said around 2 years with some filling and bonding done at the end. If you're questioning getting Invisalign, do it. And this young lady, 20 trays and a reshape. Now I smile more than ever. And this young man, he said, we're done, baby. That was his comment. And then this person said, I'm done. Permanent retainers on top and bottom too. It feels amazing. Now, all these patients prevented the damage from occurring with Invisalign. This ends portion number 1. I will be continuing portion number 2 tomorrow. So make sure you tune in at the same time around 7:30 p.m. or around 7:20 p.m. tomorrow. Have yourself a wonderful night. If you have any questions, you know how to reach me. Good night.